My name is Natasha Knowlton, and I am a nursing student at Miles Community College. And in this video, we will be doing an IV push and a discontinue of IV. My patient is my daughter, and this is not a real IV, it's just taped to her arm. So with this, you'll want to check your orders, provider orders, and check your MAR. You want to make sure you have the right patient, right dose, right medication, right route, right time, and the right documentation. Double check with your medication on what you're doing. First, you'll want to check your IV site to make sure your IV site is good, there's no issues with it, and the patient isn't having any issues as well. You'll want to check the cotton or the gauze on there, make sure that it's taped down well, that it's flushing good. You'll also, for the medication push, you'll need saline to administer 5 milliliters before the medication and 5 milliliters after the medication. So you'll do your patient identifier. Can you tell me your name?
Mariana White.
Your date of birth?
September 21st.
Okay, so you'll want to explain to the patient what you are doing, confirm any allergies, double check your MAR for that, especially with medication. You don't want to err. Double check your dosage. So when you're drawing up your medication, especially narcotics, insulin, you'll want to verify the correct dose with another nurse and make sure that is correct. So when you are doing a flush with a medication, you'll want to make sure you have the right time if it's a slow push, or if it needs to be infused over a minute, make sure you're checking those. So we've already checked our IV site. Everything is good with that. There's been no issues. You'll want to alcohol the port before you use it. Attach your saline. You'll want to flush with 5 milliliters. After you've completed that, you'll take your medication, administer as prescribed, and you would administer your medication. While you're doing that, you will ask the patient how they are doing, check the IV site to make sure it is still good and not causing any issues. There's no burning and no irritation. Once you've completed your IV push, you are going to take another 5 milliliters of saline and push that through to make sure it's clean. So with this patient, we've been given an order to discontinue their IV.
Are we done with this nursing video?
So you want to make sure you have your tubing is locked. Tell your patient what you are doing. And of course, you've done your hand hygiene. You've washed your hands. You've given your patient the privacy before starting your procedure. So discontinuing an IV, what you would do is you're going to lift your tape up. It may cause discomfort to your patient, especially if there's hair. Tell your patient what you are doing. You would have your gauze ready. And when you're discontinuing, you have all the tape pulled up. You're going to apply the gauze and pull the catheter straight out. And you would keep pressure. You'd keep pressure on that with the gauze. And you can use some cold band to make sure the bleeding stops. And assess the site, assess your patient, make sure everything is okay. And you would document what you have done for your patient. Clean up your mess, discard anything, especially the sharps would go in the sharps container. Put your patient's bed in a safe position, and you would also give them the call light to make sure that you are available if they have anything that they need, and you would document what you have done for your patient.